Hey, good afternoon, everybody, and welcome to another episode of the McShin Foundation's award-winning recovery podcast, Get in the Herd. Today, we have an American herd here because we have a herd from all across the country here to talk about something that's very near and dear to my heart because I've been a part of this for the last, 2 years now. Today, we have people with us from the National Council. It's Community Catalyst. You know what? I'm going to allow y'all to explain this better than I can because I'm going to stumble over words and you guys are so much more eloquent than I am. Our guests today are Morgan Thompson, coming to us from New Jersey. Thank you, Morgan, for being here. Good to see you. We have Tara Morena, coming to us from Flint, Michigan. Love it. And welcome back to the show. Good to see you. And then we have Joseph Hogan Sanchez, who looks like he might be in a different space than the last time I saw him on this show. Are you back in an office or have you just rearranged in there? But Joseph, welcome back to the show. It's good to see all of you. We're here to discuss a report that was just issued by Community Catalyst, and this is in conjunction with ASAM and Faces and Voices of Recovery. And I know, Joseph, you're going to talk about our supporters on this a little bit better, but this is an important report. It's groundbreaking. I see this because this is individuals in recovery discussing prioritized recovery outcomes for substance use treatment and services. So I guess to start off, I'll ask Joseph, what does this project mean for you? And can you tell us a little bit about where this came from? Oh, and I'm sorry, I did forget to say, Kyle Sunday over here on my right, he is a new person to recovery. He joined us last week for a recovery podcast, and I thought this is another opportunity to bring him into the mix, to get him in the herd. Mm-hmm. And so we here. Hi, Kyle. Want to say hello to the fans out there?
Hello, everybody. It's good to be back.
Again, glad to see you all. Joseph, tell us about where this came from, if you would, please, and tell us why this is important.
Yeah, absolutely. Again, great to be on with you all and see some familiar faces. And welcome, Kyle. This project really is really awesome, and like you had mentioned, Nathan, really near and dear to my heart as well. This work was really funded by the Patient-Centered Outcomes Research Institute, and it was an engagement award, and it's in partnership with Community Catalyst, which does a lot of research and really does advocacy work and from a grassroots standpoint, and really helps organizations, individuals, communities, as well as the organization that I work for, Faces and Voices of Recovery. We're a national advocacy organization for people with lived experience in recovery from substance use disorders and their families and their allies, and the American Society of Addiction Medicine, so ASAM. So these organizations coming together and really looking at this whole for us, by us, approach to advocacy. When we receive services, and I say we, as I too am a person in recovery myself. When we traditionally receive services, sometimes we could be, and no pun intended, we can move through the system like cattle. We can move through the system like you have like a sound background going. That would be awesome.
We're working on sound. There's the sound effect right there. We're working on sound effects.
But we can, so we can move through the system, like cattle, just being processed over and over again. Whether it's a first time into a treatment, whether it's 30, 60, 90 days, into a recovery residence or IOP, intensive outpatient, and all those different forms of treatment and supportive services, recovery support services, and then having a return to use and then automatically being told, okay, let's go ahead and cycle through again. What we know in the recovery process or what we're more familiar about the recovery process is this well-known definition of insanity: doing the same thing over and over again and expecting a different result, right? So if we go detox, treatment, recovery residence, detox, treatment, recovery residence, that's doing the same thing over and over again and expecting a different result. Mm-hmm. But the thing is that we don't ask whose result that is. Mm. With this project, we flip the script and we say, okay, people that are receiving services, what's your result? What's your outcome? What do you want out of why you're coming here? Why you're receiving services? And that's the for us part. There's nothing that should be done for those seeking help without those seeking help right there at the table. Being a part of the conversation and guiding the conversation. And through this project, there are many, many different components and opportunities for not only communities to get involved, but people with lived experience, people in recovery as they define it, people who use drugs, just all kinds of different walks and pathways of recovery to get involved. And the inner circle, if you will, would be the advisory body, our advisory council. And again, like you had mentioned, it's awesome group of folks, very diverse from across the United States. And I'm biased because I've grown really close to these folks, but they're so super smart. They have their finger on the pulse of what's happening, in their communities, all the innovative approaches, and quite honestly, what's not happening. And we started off this project identifying first what is being looked at in way of results, what people are currently considering as successful treatment. What are those boxes that are checked, if you will. And engaging folks in the conversation does this hold true? And then starting from there.
Mm-hmm. What I love about this, why this project matters, right? And I've got the 2-sheeter right here. Because when I look at this, more than 20 million Americans, and that's why I'm so grateful that this is a diverse group of individuals as part of that peer council. 20 million Americans have substance use disorders, and overdose deaths are rising, of course, during the COVID-19. We all know that the numbers of overdose deaths during COVID-19. I mean, we were already sort of plateauing before COVID, but now we're seeing incredible numbers here. Morgan. This is your first time to the show. Welcome to the show. Thanks for getting in the herd with us today. As part of this, we transition now. Full disclosure, everybody, watching and listening. I'm part of the peer council here, so that's why I'm so excited to have you all as well. I haven't seen you all in person, with the exception of Joseph. I haven't seen you all in person since June of 2019. Was it when we first all met together? Morgan, what stands out for you from this whole process and moving forward with what the results, what we've come up to see here?
Sure. So thank you so much for having me, Nathan. It's great to be in the herd today. So what stood out about this process? Joseph really summed it up incredibly well. But, for me, I guess what I would add is, just the concept of the whole initiative centering around, when I think about stigma, right? A lot of times when we talk about stigma, it's about, people use drugs or bad people or this and that. But this looks at the kind of stigma that really matters, that's more subtle, which is that systemic stigma that we see. And so inherent in the entire system of care up until this point is the idea that doctors and researchers and professionals know better what our outcome should be as people, being, involved with the treatment system. And I think that has resulted in, first of all, suboptimal outcomes that don't mean as much to the patients that have been through those systems. But even more than that, it's created a system of care that isn't necessarily palatable for a lot of people that are experiencing a substance use disorder. So like a great example, what we found and what the team found through their surveys and focus groups was that staying alive and improving quality of life was a lot more important to our respondents than stopping all substance use. And so that abstinence-based, framework that is so integral to how treatment works has maybe been an obstacle, has definitely been an obstacle to some people for whom that's not what their goal is. And so I think this has done an amazing amount of work in a short period of time to really show just how we can improve the system of care to make it more accessible for all different people.
Yeah, and what I was most impressed with the findings of this of the broad report is the similarities between different demographics, but there were some notable differences. Tara, thanks and welcome back to the show. It's good to see you, and I love your background. So I want you on the show just so I can have that fun background to look at all the time. What stands out for you, and what do you think you will take with this information into your work in Michigan?
So, in the same vein of Morgan and Joseph's, line of thinking, it's so this report is so important because it is, the grassroots. Recovery is a highly individualized pathway, right? And we have to listen to people. We have to listen to their stories and listen to what they need, right? And this is for recovery, but for the entire world. It's these people in power that try to tell you how you're going to recover, what you need, and and it's so repetitive and it's so disempowering. So this report really is rooted in empowerment. And that's what I loved about the last couple of years and working in this. It's like, what do you need for your recovery, right? What do we need people in recovery to be able to feel empowered in our recovery journey? In terms of, where I'm at in Michigan, and, the level of need that we have, specifically in Genesee County and Flint, Michigan, it's just really taking this report and carrying that message that I've been, carrying since I've started this journey with the nonprofit that I manage is, feel empowered over your recovery journey, like find that empowerment, and that is where you'll be able to really heal. Right? Not this like codependent system where I'm trying to find this doctor to save me or this treatment center to save me or this to save me. It's like, when we feel empowered, it's so much easier to really save ourselves. Right.
And I'm looking at some of the comments that we've got here already. So Patrick Jones, who's a longtime listener, and he says, look at this amazing recovery. He also says, here, take more pills. As a part of, I think what he's alluding to is sort of a response from the clinicians who will sometimes say, pills will fix everything. And he says, pills don't fix addiction. And there we go. Pills don't fix addiction, and I didn't get clean to switch one for another. Peer-to-peer is where the magic happens. Right. I like that. Robert Legg, who is also a longtime listener, he says, well, he wants to talk about expungement reform. Every week I keep reading about Michigan taking the lead on expungement reform. Way to go. And actually, for those of you listening, we've got some applause from our guests, our panelists here. And I think that level of advocacy for policymakers for change is very, very important. We do that here in Virginia. We're working on expungement as well, and other ways to diminish the stigma of addiction or to eliminate the stigma of addiction. So we look on the other side of this, this little 2-pager here. We've got some recommendations, and we've got recommendations for policymakers, for service providers, and for researchers. And what I like from this, because it does talk to a couple different, the different stakeholders here, but some things that stick out for me, and sort of what we've been discussing, is that abstinence-based program doesn't seem to always be the way for people. When we recognize that, maybe stopping all use of drugs isn't the number one priority for individuals in recovery, that we actually do need to target funding for harm reduction programs and focus on keeping individuals alive and reducing the harm. So overdose prevention, syringe services, et cetera, fund provider education on harm reduction. And by providers, McShin's a provider too. We've been in the process of sort of looking at what we do and how we're contributing harmfully and helpfully in the space. So, making sure that we are appreciative and while staying to what we're an abstinence-based organization, but also respecting and contributing to the harm reduction that's happening out in the rest of the community. For service providers, clarifying individuals' desired treatment and recovery goals. I don't remember being asked what my goals were when I first came to McShin, here, and when I got into recovery. And that's not a knock on McShin. I mean, I think, I had ample opportunity to start and stop and learn and go. And I'm not sure that my goals would have been the same day one as they would be, 3 years in now, or 3.5 years in. So, but making a concerted effort every step of the way to ask the individual, hey, what are your goals? What do you want? What do you expect to get out of recovery? And I like that. And also integrating mental health support into substance use disorders. Talk about that. Who wants to talk about that? Because that's the big giant. That's the big giant for me. That's the big giant elephant in the room. The tying together of mental health, the co-occurring mental health issue support services necessary with recovery support services for substance use disorder. Anyone want to talk about that? Quiet everybody.
Where do you begin? I think all three of us.
Yeah.
These are some smart people right here, by the way.
So trauma is, I don't believe that one person on the face of this earth has come in here without some level of trauma. And from what I've learned from, asking questions and, even tracking quantitative and qualitative data through our organization, trauma really is at the crux of the problem, and how do we get to that? And it's that holistic or that whole person, sense of recovery.
Yeah. It's interesting to me that, here at McShin, at our recovery community organization here, it's funny. I know that we have an intern right now who's calling past participants, alumni of McShin, to gather data. And we gather data in a way here that we can present to the outside world who have no idea what recovery is, based on what we see, or what they have told us their expectations of recovery are. And we measure, and I have sheets that I talk to policymakers all the time. Here's the 3 things that recovery does. 70% of our individuals are not in jail anymore. Which is, that's a great thing. Don't get me wrong, but it's like, that's the first thing we talk about, right? But for me, as a person in recovery, I don't want to be in jail, but I want to be alive. I want to have a life worth living. The second thing is whether we're employed or not. And that's important, but does that also needs to speak to whether I'm doing something that fulfills me? Is my spiritual growth happening here? Are my mental health needs being taken care of? And the other thing we measure is, very loosely, whether the individual is still in recovery. And that one I like, because that one is broad, whatever recovery means to them. But so, as we're measuring data, we're measuring for another world. We're not measuring for ourselves. And of course, internally, as people in recovery, we're all, everybody on staff is a person in recovery here. We're looking at and celebrating the milestones that we know we need to celebrate internally. So there's a gulf, though, in my view, between what the world expects and what we know to look out for and celebrate. Joseph, what do you say to anything that I've said there, or if I missed anything, anything big here?
Well, I think you hit a lot of great points. Staying out of jail and getting a job, those are measurable. At least that's, those are the first things that we measure. SAMHSA, the Substance Abuse and Mental Health Services Administration, identifies health, home, purpose, and community as major dimensions that support recovery. Now, you had mentioned, that sense of purpose. Whether I am working or not, maybe I'm volunteering, and that is my sense of purpose. I get out of bed, and the only reason I get out of bed is to go to my, service or volunteer commitment. That's my sense of purpose. And if recovery looks like that for me, based on comparison of where I was like months or years ago, where maybe I could not get out of bed, or I was, severely depressed, or I was, using substances, like it looks different. And so why aren't we measuring those things as well? And what I love about what we reported and we were able to capture in this project are those things that, SAMHSA had identified, but that we haven't been capturing. And if we are meeting people where they're at, wherever they are, in their communities and wherever they are in their journey to wellness, whether they identify it as recovery or not, we start to see how we take a more robust approach to health and wellness. So those that, may be using substances that don't identify as being in recovery, that may not go to traditional, mutual support or 12-step meetings, that don't associate, don't identify, and are, heavily, involved with their faith-based, and they find support through that, and they find purpose through that. We don't capture those numbers, right? And we don't see how, how people get well in those areas. And consequentially, those are the communities of color, right? And so when we start to look at numbers and statistics of who is getting well and how they're getting well, and what those measures that we're taking, in the report that we found, a lot of folks that identify as abstinence being one of those primary markers or important markers were not those that were people of color. So it's very interesting. And the council really brought that up for discussion. And this is something that we really wanted to highlight in this report as well.
Yeah. One of the, I don't have the full report in front of me. I don't know why I didn't print it out, but there was and do you have the full report in front of you, Joseph? Or one of the, of course, there was a for people of color, and I believe it was for African American men. There was a statistic. One of the categories that was believed was either in the top 3 or at least the top 5 was access to I think food and clothing. There was something that was an outlier for everything else except for the African American community. And I'm totally, this is why looking at this report is so important, and why we're going to be looking at this a lot going further, so we can digest and see these differences. Because even as I've been a part of this, in my daily life and trying to integrate all these different things whatever it was that was specific, and we don't need to go too far, but there was something specific there that struck me as one of those, wow, I don't even think about that. Like, I don't worry about that personally as a person in recovery, and it wasn't even really something that I worried about earlier in recovery, I guess. And it was a stark difference to me that made me, I hope soften a little bit in my approach, because now I'm in the space of being a provider, a recovery support services provider, and not just a person in recovery. So now as I go about my work, trying to be cognizant of where everybody is and asking these questions, these important questions. What is important to you? One of the reasons I wanted to have Kyle with us, a new person in recovery, because he was fantastic on the show last week, but also he doesn't know anything about what we're talking about. I kind of gave him a brief run through, right? I mean, I grabbed him just a little while ago and I said, hey, come jump on the show, and annoyed Justin because he had to readjust the cameras and the
great.
mics. Yeah. But I grabbed him because, I wanted to see, how, oh, we got motorcycles outside. Sorry about that. I wanted to see how Kyle would react and what he would think about what we're talking about. So I'm going to ask you, Kyle, just from the conversation we've had, and because we have to bring this out to the community who have no idea what this is, you're a person who's never seen any of this before. What are your thoughts bubbling up from here? What are your questions that you might have, and what do you see? Do you have any idea what we're talking about?
Well, I'm still getting there, but it sounds to me like there needs to be a lot more research, because there's so many pathways to recovery. Like, the peer-to-peer stuff, the counselors, they got the Dharma, the smart recovery. And really, I don't think a lot of these statistics are being taken from, all these different ways. Because I remember seeing the statistics in a meeting, and it was so depressing, like, to see, some of this stuff that's going on. And I just don't think that all the polls are being taken and the statistics are being recorded about how people are going about the recovery, because there's so many pathways that you don't know who's being successful and who's not, and we need to find out what's best for anybody else, because that's the only way you can refer them to that. Because maybe they might do the peer-to-peer recovery and not like it, but then you can coach them to do the smart recovery or to do the faith-based, and that might work for them. And there's just so many ways to recover. We just need to gather information on them all so that we can save people's lives. I guess that's what I got.
And to add on to that, Kyle, who defines what successful is?
Yep. Yep.
Yeah. One of the challenges I think we faced as a council, or I maybe not we, but the individuals who were finding the people to take the survey, was actually getting out and finding individuals who represent certain targeted, marginalized communities who historically have been disproportionately affected by substance use disorder. And it was a challenge to do that. And I know that, I reached out to people, and I actually had, I reached out to individuals in the trans community who are not in recovery, who may not need recovery, but individuals I know, and they were reluctant to send this out to their communities. So there's a that pain, that stigma right there too. How did we overcome that challenge? How do we need to continue to overcome that challenge? How do we reach the people who need this more? Thoughts, Morgan?
Yeah, I mean, so, I think it's a continued conversation and a continued effort. I don't think we can call the report that we've put out, conclusive by any means, because we weren't able to proportionately reach, those communities that have been historically underserved. And it for me is a kind of a reflection on the fact that, it's safer for me, as a white woman, to speak out about my recovery, that perhaps I might not face some of the same, level of stigma or repercussions, or, that there's levels of stigma and that there's systemic racism. There's all these other intersectional factors that I don't necessarily experience. And so while I can feel safer to speak out about my recovery publicly, that doesn't mean that my recovery is representative of everyone's, and that I need to be very mindful of that privilege and not assume that it means I know something, right? And if anything, for me, this process has helped me to understand just how little we know about what the true recovery community, when we cast that, that inclusive net, we don't know what's working, what's not working. And for me, what came up a lot is there's so much knowledge and expertise that we have not tapped into because we haven't created safety for, for particular communities to speak out in the way that others can.
I love what you just said there. And I love that this is a step towards more inclusive, creating a better, safer space to have these conversations. I've had some very hard conversations over the last year regarding race, gender identity, sexual orientation. So, and I'm grateful to be in these safe spaces where I can have those conversations. Tara, how can we do better?
How can we? It's a very big question.
I believe in you.
Thank you. Oh, I adore you too. So, it's really an inner journey. I mean, that's, all I can say is that, it really comes down to, it's all about how we respond to the world around us, right? And people that, people like us that work with people and that help with people, it's so incredibly important that we take care of ourselves. And I talk about this a lot. And I talk about this a lot because, what we run the risk of doing is, transferring our trauma, passing it down, passing it over to other people. Right. And we see a lot of that in the treatment centers. We see a lot of that in, certain recovery, groups, outlets, whatever it's everywhere. If we're overwhelmed, if we're stressed out, that impacts people around us, right? So the best thing that we can do is really take care of ourselves and love ourselves in a way that it emanates from us, right? So that people feel that. And, for those of you, who are in recovery with the 12-step process, when we choose a sponsor, they always say, choose somebody that has something that you want.
Right.
And that peace, right? You want that peace, right? Yeah. We all do. So
yeah, that inner peace, and that's funny you bring this up because I've had a few sponsors over the years and they all had what I thought I wanted. And finally, when I realized inner peace is what I was looking for, it was like, oh yeah, this is so much nicer now. Joseph, what do you think we can do to do better? I see that. It is a big question, but it's a big question, and we all this group of people that we've all been together have so many resources at our fingertips, and these are 4 out of what I think the group is 10 of us. Was it 10, 16 with the counselors and stuff? I'm throwing that number out there, but we have collectively all across the country this group of people who have all these resources. So what can we do better?
Well, to echo what Tara had said, I think that first off we start with ourselves. Where's that education? How are we educating ourselves? This report helps to give us a snapshot of, and also hopefully empower individuals to raise their voice. I mean, again, this is an opportunity that was afforded to us by, Patient-Centered Outcomes Research Institute. Mm-hmm. It's people first, people that are receiving services first. So let's put people first. Thinking about what I want, what we want, what our communities want out of the services that we receive, and also raising our voices and speaking into that. You know, if I'm not getting my needs met, and I don't talk about it, then my needs will continuously not be met. You know, closed mouths don't get fed. So in this report, we identify, as you had mentioned, a few different ways that individuals can use this report, bring it up for conversation, for decision makers, for treatment providers, and so on and so forth. And we are at this place with new administration where the Biden-Harris administration has identified those priorities, those drug policy priorities that there are a lot of overlaps there. In 2020, not only did pandemic hit, but we as a nation saw a lot of visual, just outright, racism. And systemic racism has always been there, but a huge spotlight, was put on that last year. And one of those policy priorities is advancing racial equity and access in issues that are that are approach to drug policy. So if we start to think about people of color or communities of color, if they're having trouble or difficulties accessing treatment or supports, why? If we need more research, let's advocate for more research. If we need for changes to happen, let's advocate for changes to happen. Instead of just saying, oh, well, that's interesting, and then go about our business and continue the same thing, repeating the same pattern over and over again and expecting these numbers to magically start to get better. We know that some of the communities and populations that continuously go underserved are that of unhoused individuals or people that are experiencing, homelessness or being unhoused, and those of the LGBTQ plus communities, right? I can, and I think you even reached out to me with this question. I mean, thinking about the amount of recovery residences or just even safe places to live for a trans person of color.
Yeah. What I have experienced in recovery, because, as you all know, and I guess probably most of our listeners know, I'm a person in recovery too. And I was very fortunate to find myself in a recovery community organization, which helped me to find my voice, and yes, McShin, I love McShin. And I have a tattoo on my arm with the logo. And there are recovery community organizations all across the country, all across the world, but all across the country, doing the same or similar work, to better or worse, but doing the same work and empowering. This word empower, emboldening is my favorite word right now. Emboldening others to come out and come forth and speak about recovery and what that means. Because my story may not be relatable to you. My story is still partially your story. Your story is definitely part of my story, but I'm going to relate to somebody. Kyle's going to relate to somebody. Joseph, I know you're going to relate to somebody. Tara, Morgan, you're going to relate to others. So it's important. I find being empowered by the recovery community organization that I came to use my voice to help others to find their voice, and I think we just took a training and it taught me something, and I can't remember exactly the leadership definition, but I was just in that space for 12 weeks, and gosh darn it, it's usually right behind me on the wall, so I just have to turn around and look at it. But essentially, it's my responsibility as a leader to empower others to meet the challenge and become leaders themselves, and so this is what this helps me see. When I can look at this and say, what are your priorities as a person new to recovery or coming to recovery. What are your priorities? Then I can help you to advocate for yourself. Because ultimately I have to advocate for myself, and you have to advocate for yourself and yourself. And learning how to do that effectively is empowering. And then I can move to whatever that next step might be for me. We talk about Maslow's hierarchy of needs. If I get the food and the basics met, and we start getting into purpose and we start getting into the arts and things, which, I would argue that there's some difficulty with Maslow's hierarchy, but that's another story and another show. But when we can look at this priority of needs, how about that? The report's priority of needs, we can start to meet those needs or help individuals find ways to meet their needs. So, Kyle, as a new person to recovery, and so Kyle, you're a person in recovery. You are you've had experience in recovery prior, and you've now come back to recovery. What without even looking at this sheet or without even thinking about it, what's the first thing you think you need to do, for your recovery right off the jump?
To me, and it's on the sheet, is stay alive. I'm lucky enough to make it back because not all of us do. This isn't my first time in recovery. I've been doing this stuff a long time, and I'm just grateful to be alive and be here because we don't all get that chance. And McShin gave me this chance to be here, and that's one of the things also I think we need to work on is expanding programs like this, because like the Leela that we were talking to last week, they can't even get Narcan in her state, and we have a dude from Maine that had to fly here all the way from Maine because he wanted to get help so bad and there was nowhere open for him to go, so he flew all the way down here, took 2 planes. I mean, the recovery community needs to be expanded. The stigma needs to be taken away. We need to get help for everybody, and some places don't have that at all. And I'm just lucky to be in a recovery community like this. I mean, everywhere you look, there's people in recovery. Not everywhere is like that. I mean, people are dying because of it, So I'm glad for people like this that are fighting, for that stuff to be expanded and realizing that, look, we need to get help. We can't just let these people keep dying. That could be me. That could be you. It could be anybody.
Yeah.
And, that's the most important thing for me is to stay alive because I'm going to get it. I'm going to get it.
When all of our participants come to McShin, they all take an ASAM survey when they get here, and so this project is part in part brought to us by ASAM. What do we expect, or what do we hope will come from this report as a next step? Because because there's also recommendations for researchers here. The research recommendations are investigate which treatment and recovery support services, including peer services, which I'm always going to advocate for, best achieve the outcomes patients want. And also stratify all comparative effective research and patient-centered outcomes research related to substance use disorders by race, ethnicity, and gender, and report findings of these demographics to inform clinical and non-clinical recommendations and policy solutions that address systemic inequities. Where do we want to? I mean, this is obviously where we want that to go. Where do we know that this is going, or where can we advocate for this to go?
I think the sky's the limit right now. So we, just released the report, and the Community Catalyst team, Faces and Voices, and ASAM, we're just trying to help get the word out. So we're knocking on doors, we're having meetings, and we're having conversations like this. Just to get the report out and just to get that knowledge out. We know that this is just the beginning. Yeah. And so with those recommendations to, other researchers, it's like, come on, let's pick up the torch. We'll work with you, to do more research, but also to check back at the work that you have done to see if it measures up, to see if we are hitting those areas. And if we're not hitting those areas, how can we? Right? How can we? And do we need to do more research? So I can't speak on behalf of the Community Catalyst team, but I know that, in our conversations, they are up for, partnering and collaborating and further continuing, this research, and getting to a place where we are getting a more robust composition of just research and population and those hard-hitting points. So I think right now the next step is getting the information out, and now we know, and we can't say that we don't know, right? Mm-hmm. And one of the things that came out of 2020, so this project, to backtrack, we started before a COVID pandemic hit. So we're thinking easy research project, and then the national pandemic hit, and what an interesting opportunity to be able to pivot and say, okay, well, what's important now? Yeah. And of course, we've been hearing a lot of the echoes of the importance of connection and people missing that connection. And also, from some of the focus groups, because we got guidance from the advisory council, but also we got feedback from surveys, but we also engaged a lot of groups and focus groups as well. But what we heard in focus groups were different ideas. And when pandemic hit, we were able to, we were given the opportunity and additional support to pivot and, ask, pretty much the same set of questions, but from, this pandemic, perspective. And even think about, after things start to get better, what would that look like? And how providers, whether it's treatment or recovery support services, how we should be preparing for that. And, again, with communities of color, talking about, internet access, access to technology, access to knowledge to navigate technology, just all of that, just bumps in the road when it comes to, inequity. So how do we start to keep that in mind as we start to plan for reopening, for delivering services, if we're planning on delivering hybrid services, being cognizant of those that may not return to physical services? How can we best support them? What does outreach look like now in our communities? If we're more cognizant that there are still marginalized populations, do we still continue to do business not reaching out? And how can this report start to inform the conversations that we have within our organizations, within our treatment centers, to be more cognizant and intentional in reaching out to our communities and, having them tell us. So doing any kind of community strengths and needs assessments, building stronger relationships with those communities, because that's where you're going to hear what those people, and those communities need and want in way of services.
Yeah. All three of you are service providers in different locations in the country. Morgan Thompson over here in New Jersey. How is your organization? How has your organization been doing? With the pandemic, but also now that we're coming, sort of in a way coming out of the pandemic, or at least the laws are, policy is coming out. How are you pivoting, I guess, back to something that was before, but now different? How is that for you?
Well, of course, safety is first and foremost, but balancing the, safety from the COVID perspective with safety from the isolation and disconnection of people with behavioral health conditions. It's a safety issue on both sides, and we've had to kind of balance the two from the start. So what it looked like for us is, for a period of time, fully, virtual services. And what we found was that We did lose contact with a certain percentage of our participants, fewer than I expected though. But we also engaged people that we had never engaged before, or we re-engaged people more meaningfully than we had in the past because the virtual platform was more accessible for them. It was more appealing. It didn't require them, to figure out childcare or whatever it might be. But then for others, it was like, yeah, give me a call when I can come to the office because I can't do this virtual thing. I don't want to do this virtual thing, and we did what we could in those situations to meet safely, whether outdoors. And so now a lot of focus on, now that we can, some of the mandates have changed here in New Jersey. So we've been able to do some in-person gatherings and starting to do more support groups in person. And, it's a beautiful thing, but we also know that we want to keep the virtual services, a big part of what we do, because for a lot of people, that's what's practical, that's what's possible, and that's what they prefer. And so we're excited to be able to, have kind of that hybrid service format going forward.
Sure. Before, and we are closing up on the hour, but before we do that, and I do want to ask the same question of the two of you, excuse me, Morgan, what is the name of your organization? What part of New Jersey are you in?
Central. Does exist.
I'm from
we're
South Jersey, so I can
Okay.
attest to that.
Okay. So my office is based in Union County, very close to Newark Airport. If you ever come to visit us, you probably come through Newark Airport. But I'm also the co-chair of the New Jersey Coalition for Addiction Recovery Support, which is a statewide recovery community organization.
That's awesome. Thank you for that, and I'm glad to see you and glad to have you on the show for the first time. I hope it's not the last time.
Glad to be here.
Awesome. Tara, same question. We just had you on the show, I think a month or two ago, and it's good to have you back. But how are you? And I'm stealing the word from Joseph. He said pivot, and now it's stuck in my head. How are you pivoting to this new reality, to what's going on?
Really just keeping a pulse on the community and seeing where everyone's at. With our organization, we moved everything that we could virtually until June of last year. And then we started gathering in person again. So we actually served just under 500 people in person last year, which was about 1,500 people less than the year before.
Wow.
Yeah. We were very, just like Morgan said, we were very mindful of, right, the COVID and then the addiction, right? Because the overdoses that were happening, because we were very aware that the fear and the stress, and then, these stimulus checks that were being distributed in our community, we were seeing a rise in overdoses when these stimulus checks were, distributed, and keeping, knowing what's going on within our community, and then kind of following the vibe, if you will. Now the larger gatherings, so that's something that I've sat on. We have not planned our walk and rally yet. We are actually going to be gathering this summer for a first larger gathering. So really, it's the pulse of our community. So I would love to be able just to kind of gather more and do things more, but I think our community is still kind of trigger shy. So, so it is COVID. I will stand by COVID and the catalyst that it was for the transformation to happen, because people are coming to us that would have never come to us before, and they're opening up their minds and their hearts to recovery. Our mission includes not just substance use disorder, but codependency and trauma. So people who do not identify with substance use disorder feel like they have some place, if they're willing to, work through those issues to come. So, yeah.
And I'm a fan of what you do as well. Thank you for being here with us on the show again. And I hope that we'll see you again for another show going forward. Joseph, when I visited with you back in when was I there? July of last year. I was in Austin. Orla's on here. Orla says you are all amazing. So I want to throw that out there. Orla's watching. Well, for those of you who don't know, Orla has been our I don't know her actual title, but she's been our organizer extraordinaire throughout this process since the very beginning. So good to see you watching, Orla. And I know that I know that we I hope. Well, I know the three of y'all did the report proud. Joseph, in July, I visited with you, and I saw your recovery community organization. How? And I'm sorry if I'm putting you on the spot here. How is that going? How is that? How are things with that? And again, apologies if I'm putting you on the spot.
Yeah, no, no problem. So I did have the pleasure of being a founding member of a recovery community organization here in Austin, Texas. I would say that was one of my passion projects as a board member, being a volunteer. Since I've rotated off the board and just really focusing a lot on the work that I'm doing with Faces and Voices. And but I do know that the work that is being done by Recovery ATX here in Austin, Texas, they're opening the doors. I just saw a few different events that, of course, limited capacity events, being very mindful of that. And, I think those mindful, limited capacity gets us into a place of being intentional in our connection, and being more mindful about how we provide support and how careful we're doing that as well. So from a Faces and Voices and national standpoint, we've seen a lot of recovery community organizations from, March of 2020 shut down completely and get empowered or emboldened to really pivot and learn and get on this, online recovery support, whether it is a mutual support meeting, whether it's yoga, meditation, whether it's just hanging out and just staring at each other and making faces. We are resilient people, and that is something to note. That our communities are very resilient, and I think that although I love our physical time together, I don't think that Zoom meetings and online platform meetings are going away anytime soon. But I do appreciate that they're pulling back a little bit, because I can't wait to come in for a real-time hug. Again, one of those things that we heard a lot in the work that we did, especially when we, were able to refocus this project and look at priorities and outcomes in way of if they change during the time of national pandemic, was that sense of connection, was that connection to the community. And, through this project, we were able to hold space for each other, and the relationship that we have with ASAM and our community partners. Orla, shout out to you, because I see you here. I was busting her chops. I'm like, Orla, what? You're not listening in? So she but the support, being able to be compassionate, caring, and just hold space for each other, and I think that is where we are at nationally, and hopefully we're able to use this report in our communities to really build up and build out how we reach out to our communities. There is if you're not dropping it here in the thread here, you can always go to communitycatalyst.org and check out the 2-pager and the gazillion page report. It's not gazillion pages, but the full report. Yep. Thank you.
There it is,
Boom.
yeah.
Yeah, there it is. Thank
It
you
was
so
also it
much.
also went scrolling a few times through the show, but we'll say it again because for those who are listening, communitycatalyst.org. That's communitycatalyst.org. And I think I cut you off there, Joseph. I'm sorry. I got distracted. We had some sirens behind us over here. Anybody who's listening and has a funding stream for these types of recovery podcasts, I'd be interested in putting in a request for some. What's the word I'm looking for? Some soundproofing of the space here, so we can minimize that, and we could also have the AC going at the same time. You all know, but little steps right now, because right now, one of the things that McShin did throughout this process of going through COVID was enhancing our online, presence and having these conversations. And so, thank you, Joseph. Did I cut you off? I'm sorry.
No, you're good. You're good.
I really, really appreciate you for joining us, Joseph, too. Tara and Morgan and Joseph, you have been exceptional guests, and you're all three my friends. I'll look forward to seeing you on the show again soon. Kyle, you've been a fantastic supporting host over here, and thank you for your insights. And do you have any questions before we go?
No, I'm still just taking all this in. I'm just here to be a sponge and take all this information. I want to thank you guys, because it's nice to be around people who are doing a lot of different things, because I'd like to learn as much as I can while I'm here. So it's great. Thank you guys so much.
That's awesome. Thanks, Kyle. Thank you to everybody who watched. I know we did have a few comments people enjoying the show, and there were names that I've never seen in there. So that's awesome to see some new some new names in the comments, and I look forward to bringing more regular guests, getting more regular guests out of you. Boy, you know what? You get to an hour and I'm done talking. Sorry. Thank you again to Justin and to Derek over here, who's taken in some assistant producing duties over here for being exceptional producers. And of course, to everybody at the McShin Foundation for helping us put this podcast together. And a shout out to PCORI. What does PCORI stand for? Patient-Centered Outcomes Research Institute, for putting this project on with Community Catalyst, Faces and Voices of Recovery, and the American Society of Addiction Medicine, also known as ASAM. Thank you all for participating, and good day. Thank you.
Bye, Nathan.
Here at McShin, we believe in the McShin way, which is authentic recovery support service providers, people with lived experience, bringing that experience to those who need that lived experience in recovery.
Here at McShin, we believe in many things to support our mission. We believe in women empowerment.
What I love most about what we believe here at McShin is we believe in the authenticity of the peer-to-peer approach.
Here at the McShin Foundation, we believe in giving people opportunity.
Here at McShin, we believe in the inherent worth and dignity of every person.
At the McShin Foundation, we believe in helping people reach their full potential.
Here at the McShin Foundation, we believe in multiple pathways to recovery.
Here at McShin, we believe in placing principles before personalities to help spread hope.
Here at McShin, we believe that recovery is possible, and that any person seeking recovery can become a more acceptable, responsible, and productive member of society.
Here at the McShin Foundation, we believe in self-discovery.
Here at McShin, we believe in saving lives and offering second chances.
Here at McShin, we believe you can do this.
Here at McShin Foundation, we believe that we can only keep what we have by giving away, which is why we continue to help others like us seek and find recovery.